There's a lot of misconceptions when it comes to seizures. If you've ever seen someone having one, it might seem confusing or scary at first. Symptoms typically include muscle contractions or muscle spasms, fainting, or even a loss of consciousness. When we do see someone having a seizure, what do we do? What causes them? Will it hurt or alter someone's state of mind? And are there any treatment options? Baylor Scott and White Health epilepsy specialist Dr. Sadat Shamim has more on what you need to know about seizures and epilepsy.
A seizure disorder is a condition in which a person, the brain fires uncontrollably in a rhythmic fashion. So the part of the brain from which that increased activity is originating doesn't work appropriately. And you get symptoms because of that. Those symptoms are called seizures. When someone has a seizure and has a propensity to have more seizures, then that's called epilepsy. Seizures can be caused by many different things: metabolic abnormalities, medications, drugs. But on the other hand, epilepsy is when someone has seizures not because of those things. It's an inherent, intrinsic cause within the brain. Anything that irritates the brain can cause someone to have a seizure, and if someone has a focus in the brain that constantly is irritating them, that will make them have recurrent seizures and define them as having epilepsy. So about 2/3 of patients who have epilepsy, we usually do find a cause, but 1/3 of patients we never actually do find a cause. But it's always helpful to look because some of those causes are very treatable.
Now that we know what seizures are and what causes them, are there any treatments? And what do we do if we witness someone having a seizure?
Epilepsy is treated primarily with medications. About 2/3 of patients who get put on an epilepsy medicine, their seizures will stop. The other third of patients, the seizures don't necessarily stop or aren't as well controlled. We can add more medicines, and we do get control of some of those patients with the medicines. And occasionally there's a patient who has epilepsy that's not able to be controlled by medications. In those circumstances, that oftentimes means bringing them into the hospital, into an epilepsy monitoring unit, where we can take patients off their medicines and allow them to have some of their spells. And when they have their spells while they're being monitored, we're then able to better define what kind of epilepsy they have. If they in fact have epilepsy, occasionally we find that they have something else that looks similar.
If you've had a seizure and know that you have epilepsy and are physically okay after the seizure has passed, the next step is to let your doctor know so they can adjust your medication if necessary. If you have never had a seizure and suddenly do, call 911 or have someone around you call 911 right away and let your doctor know. If someone around you does have a seizure, make sure they are out of harm's way. Try to roll them onto their side and make sure nothing is obstructing their breathing. If you have seizures, through education and awareness, those around you like coworkers or classmates can properly know how to handle the situation and get help when and if necessary. For Daily RX, I'm Gabe Garza.